A very good morning to all. And also, I would like to thank the JPF for inviting me to chair this session. We have an important topic, the essential shorts list. No, we all know the importance of vaccinations nowadays because there was a big study which went on for 52 years, and one of the primary findings is that people who took flu shot every year live longer. That is the third important factor for longevity. So I think the apt person for speaking about that is Dr. Arun Shankar, who is a medical director of JPEF, and also he is secretary of IMA. He is an executive editor of International Journal of Diabetes, and he has a lot of credentials. I think everything is projected there. You can read that. It takes a lot of time. Over to you, Shankar.
Thank you, respected chairperson. Dear friends, at the outset, let me once again thank you all for making JPEF 2025 a grand success. Yeah. So I can see so many young faces, young doctors waiting here because after the session we will be having the quiz JPEF 2025. So as clearly mentioned by the chairperson, whenever we are discussing about a comprehensive care for our diabetes patients and we are trying our level best to prevent the so-called microvascular complications among our patients in future. Meanwhile, many a time we forget to address the infections or the preventable diseases among our patients which can be carried out with the help of these vaccines available. But unfortunately, we are always discussing about pediatric vaccination, not the adult vaccination in our country. So people with diabetes are at high risk, like getting these infections included, mainly including influenza, pneumonia, hepatitis, shingles. Just now we had a wonderful discussion on shingles, how to prevent shingles infection among our patients, and tetanus. So these are the preventable infections among our patients. So actually, while addressing all these factors in diabetes management, if you are incorporating the vaccination part as well, you will be able to improve the quality of life of your patients, including having a better prognosis, not only the reduction in mortality or morbidity. So while vaccines have been a part of our healthcare for decades, their significance has gained unprecedented momentum. Only the recent corona, which we had the pandemic infection recently. So coming to the most common or the commonest infections which are preventable among our patients, first, of course, the pneumococcal infection, the pneumonia, which is very commonly seen among our patients, including our diabetes patients. So immunization here, or the vaccines which can be used to prevent pneumonia, is definitely a cost-effective measure to prevent the so-called the burden which patients or the patient's family will have to face while a single hospitalization which will require during the severe infection which they are going to have. So people with diabetes, again, they are at higher risk of getting pneumococcal infection. And the most commonly used vaccines for preventing pneumococcal infection, the two types of pneumonia vaccines, you can see pneumococcal polysaccharide vaccine, the PPSV, and the second one is pneumococcal conjugate vaccine, is the PCV. So way back, I think in 1983, the PPSV, that is the 23 serotype containing vaccines, that was the one which was started to use. And later, the other vaccines, including the PCV, we are using right now. Among PCV, you have PCV 13, PCV 15, and PCV 20. These vaccines actually not only prevent the infection, again, the hospitalization due to infection and the prognosis will be much better while giving these vaccines among our patients. So going by the guideline, you can clearly see the recommendation from the international guidelines and our own national guidelines also recommend the usage of pneumococcal vaccine. So in the category which is clearly shown in the column, that is those patients who are not having any other comorbid condition above the age of 19 up to 64 years, irrespective of the comorbidities, like you can give PPSV 23 first, and after 1 year they can have the PCV vaccine. The other way also it is recommended, and if there are comorbid conditions, the immunocompromised state is there, means again the recommendation is if there are no history of prior vaccination, you can go for PCV 15, and option B is also there, that is PCV 20. So the different age groups also clearly shown here. And coming to our own guideline, that is the RSSD recommendation, that is here in India we have only PPSV 23 and PCV. These are the available vaccines in India. So you can go for these vaccines among our patients. So for the age group of 19 to 64 years, starting with PCV, if it is taken already, means you can give the PPSV 23 1 year later. PCV 13, of course, adults above 65 years of age, if vaccinated with PCV 13, you can follow it up with PPSV after 1 year. So the next one is the influenza. Influenza, it can affect any age group. So again, not only the infection, just with influenza, not just the infection, you have the patients ending up with cardiovascular complications as well when diabetes patients are having this influenza infection. So of course, when they are getting admitted, means there is more severe clinical course being observed among our uncontrolled diabetes patients, which will worsen their health. And of course, the recurrence of the infection with influenza is also seen. And with coming to influenza vaccine, you have the updated vaccine, that is every year the vaccine strain will be changing, and the ideal time to start or to take the influenza vaccine is September. That is why the seasonal vaccine, among the seasonal vaccine influenza, the recommended time is to start on September. In addition to protecting from the flu, of course the vaccine has proven to be protective against cardiovascular and cerebrovascular events among people with high risk, that is diabetes as well as COPD. And influenza virus can infect the same individual repeatedly as the virus undergoes the rapid evolution, the antigenic drift, which we commonly see among our mRNA, that is influenza, which will avoid the immune memory cells. That's why the patient can have the recurrence of infection. And again, if at all the immunization is being done, that doesn't mean that the patient won't be getting an influenza infection. The severity of infection will be less, and if at all the patient requires treatment, it will be of milder form, not like the one whom are not taking vaccines. It won't be that severe. And coming to the recommendation, in the Indian scenario, the present vaccine is the 4 strains, that is the influenza A, 2 and influenza B 2 strains. So that is the quadrivalent vaccines which you are using every year, that is being recommended. So coming to the hepatitis B infection, this is again a major global health concern, and infection can lead to liver fibrosis, resulting in an elevated risk of cirrhosis and hepatocellular cancer. And HPV is mainly transmitted through the various routes you can clearly see in the slide. So among the vaccines available for hepatitis, you have the recombinant vaccine, which is much more effective. And coming to the recommendation, the 3 doses being recommended, that is given on 016, and of course this is optional. Then you have the TDAP vaccine. TDAP vaccine series is recommended to protect against tetanus mainly. The effectiveness and safety of Tdap vaccine among people with gestational diabetes have been published in multiple studies. However, evidence in type 1, type 2 and Indian population, it is actually less. And going by the guideline or the recommendation, all adults to have a single dose and pregnant individuals to have an extra dose, that is being recommended, and revaccination after 10 years. And like what I said, today morning we had a very good discussion on shingles, that is a herpes zoster infection. Varicella zoster virus is the causative agent of chickenpox, and herpes zoster is the causative agent for shingles. And following primary infection of chickenpox, shingles develop at a later stage whenever there is a risk, that is a reactivation of the existing virus, that it ends up with herpes zoster or shingles. The disease causes symptoms such as painful neuropathy and dermatomal vesicular rashes. And according to the CDC, 1 out of 3 in the Western statistics, it has shown that developing shingles in their lifetime. And people with diabetes, definitely they are at higher risk for getting zoster infection. So to prevent zoster infection, of course, you have the zoster vaccines available. Live attenuated zoster vaccine is there and recombinant zoster vaccine is there. But with regard to shingles vaccine, of course, the cost matters, and the recommendation is all adults above the age of 50, you have the 2 different doses given at 2 to 6 months after the initial dose. Of course, like what I said, cost is the main concern. And of course, during the COVID time, we have seen that all the infections which we have come across among the vaccines, the discussion on vaccines in adult only started with the COVID pandemic. So COVID vaccination, again, we are not taking nowadays, but the recommendation is to go for COVID booster vaccines. And from our center, actually the flu shots started in 2009, and we are also giving pneumococcal vaccines as well as shingles. Till date, we haven't come across any serious adverse events after taking vaccines, and all those patients who are taking flu vaccine every year, they are asking for the vaccines, because once they have taken the vaccine means they could prevent the infection, even though many of their family or the friends, when they are getting infection, these persons who are already vaccinated, they are not getting any severe infection. And the data from our center, this was published, presented in IDF 2013. And coming to our part of the world, definitely like what I said, adult immunization is not being much addressed. But to improve adult vaccination coverage in our part, definitely with the help of which we can break the chain of infection to reduce the burden of disease among patients with chronic conditions, including diabetes and other immunocompromised states, which will prevent the infection in future, means that will help the patient. So you have so many adaptive methods to recommend or suggest to your patients. With the help of your team, you can motivate them to have vaccination. Simple 4 actions can improve adult vaccination rates in your practice. That is, assess the immunization status of all your patients during every clinical encounter, provide a strong recommendation for vaccines that your patients need, and administer those vaccines whenever the time it has to be administered. And of course, when you are giving the vaccines, just like the pediatric vaccination card or which we are giving for them, you have to keep a record of vaccination, because like flu vaccine and the other vaccines, the time is important. The last vaccine and the next booster vaccine can be planned accordingly. So to conclude, vaccination is actually a critical yet often overlooked part of diabetes care. An individual with diabetes face a higher risk of complications from infection which they are getting during their course of treatment. So all these guidelines, any body, international or national bodies like ADA or RSSTA, definitely recommends the usage of vaccines among your patients to prevent all these infections which are preventable, and to avoid the treatment burden, the cost involved in treating complications. And like what I said, the newer one which is added or being discussed right now, the shingles vaccine, the data which was discussed by Dr. Arjun today morning, which clearly shown that if you are going to prevent shingles infection, means that will help your patient to avoid the cost involved in treating complications after getting the zoster infection, ending up with cardiovascular or any other blood vessel complicating disease in their future. So with that, I would like to thank you all.
That was a very clear discussion regarding the vaccination. This is applicable not only to diabetes. Vaccination is something we all, especially when we treat adults, we ignore. It is high time we take into consideration vaccinating all adults, especially above 65. That pneumococcal vaccine is mandatory. Any questions from the floor?
One question from me now. Normal adults, of course, they do need vaccination to prop up their antibody levels. But in diabetes, where both humoral and cellular immunity is poor, will the body actually produce antibodies against these diseases? I think it will not be good, maybe partial, but still, I think it should work, is it?
I think when I went through the data, there was data clearly showing that even though the patients with diabetes, like what you said, the immune system is not that clearly working, but among the patients who had taken pneumococcal vaccines, the immune response was much better after taking vaccines. That's why they could prevent the infection in future after taking the vaccines. And with regard to pneumococcal vaccine, the protective response is there up to 9 to 10 years.
May I add, sir, regarding diabetic, to answer your question, see, in certain immunocompromised states, the people have clear guidelines have been given to give double dose or more dose. For diabetes, that is not given. There is no study like that. Diabetic people also develop immunity reasonably well. But to answer your question, there is no such study regarding pneumococcal vaccine in diabetics and non-diabetic and level of antibody study. I am not aware. Are you aware of any study? No.
Less, yes. Yes. In the recommendations, it has not been mentioned like that, but what you said is right. Many a times, patients are doing the titer and seeing the antibodies levels are less.
Yeah, that's what. The take-home message is that don't ignore the diabetic, give him the vaccination.
One more thing, sir. The antibody level always does not correlate with immunity. Many a time we know that antibody level and immunity is not the same. There are unknown mechanisms, cellular mechanisms. So simply by saying antibody level may not be that correct. But as you said, it is a definite indicator. If there are no other questions, I think we'll close the session. Thank you, Arun Shankar.
Thank you, dear Speaker and Chairpersons. I now invite Dr. Mahadevan K.